Hi, my name is Dr. Laura Stachel. I'm the Executive Director and co-founder of We Care Solar. And thank you all for joining us both in person and on Facebook Live. And today is the 10th and final week of our 10 by 10 anniversary series. We're celebrating a decade of impact. And this week for our final webinar, we're really thrilled to be sharing the power of scale. I wanted to thank everybody who's been watching our 10 by 10 webinar series, participating in events, and let you know that on our website, we actually have a page that's a 10 by 10 page. So if you missed any of our prior webinars and you want to catch up, please go to our website, find the page, and you can really enjoy any of the webinars we've had. But without further ado, I'm going to turn this over to Samantha Parsons, who is our Chief Operating Officer, and she'll be introducing the webinar and our guests. Thank you so much.
Thanks, Laura. We're really excited this morning to have, I would consider it an esteemed panel from several of our partners that we have worked with and side by side, but all represent organizations that have had various journeys to scale. And we thought it would really be an enriching conversation to bring this group together from We Care Solar, from Last Mile Health and Living Goods, to talk a bit about the journey of scale and to better understand and answer some of the questions about what does that really mean for an organization to scale, and how do you go from a small idea to something much larger, and what are the steps in between and the decisions that you make and things that you consider on your pathway to scale. And we just thought it would be a good opportunity to bring these three organizations together and to talk about those journeys. So I'd like to welcome our panelists, and I'll start with Christina because she's in my first Zoom box, but she is our We Care Solar Senior Director of Global Programs. And Christina has been with We Care Solar for the last 6 years and has really experienced that journey firsthand through the development of not just our technology, but really the programmatic model that we use to deliver the solar suitcase and the programs to last mile health centers. So Christina will be adding in lots of interesting tidbits about our journey and various elements along the way. And to her right is Alicia Mccormick from Last Mile Health. Alicia is the president and COO of Last Mile Health. And we have worked along the way with Alicia, particularly in Liberia, where we've had the opportunity to install in many of the health centers of which the community health workers that Last Mile Health supports work throughout all the various counties in Liberia, which was our first Light Every Birth country. So we're really excited also she's been with the organization for a long time, and to understand more about their journey and the decisions they've made along the way. And then further down just a little bit, you'll see Lisa McCandless from Living Goods. She's the executive director of the US for Living Goods, and has also been with Living Goods for quite a long time now. It's what, Lisa, 8 years, I want to say. 6
Well,
years.
7, close.
Yeah. And also has gone on a real pathway to scale with Living Goods, and has had all different kind of variations within their journey. And we've been fortunate enough to bring these groups together that have had various partnerships and different synergies along the way as well. And Alicia and Lisa will be able to speak to that also. So just welcome to our panelists, and we look forward to the conversation. Just a couple admin reminders from the We Care Solar team. If you can remain muted the majority of the time until we open up for Q&A. During the last 15 minutes, we will have questions and discussion, and we'd really strongly encourage you to ask questions as they come to mind, and we'll be collating them and bringing them back up during the discussion period. So we'd really like to hear from you, and we'd really like to engage in a discussion and share experiences. So please feel free to do that along the way by using the chat, and we'll be moderating that and collating that at the end. And then in addition, if you have targeted questions for specific panelists, please feel free to let us, go ahead and tag those, and we'll collate that towards the end. The other small kind of housekeeping thing would be to feel free to introduce yourself also through the chat. Tell us who you are, where you're coming from, and any little tidbits that might be relevant for the rest of the audience. I think it's really nice in this virtual environment that we do have the opportunity to meet people from across the world who are doing various kinds of work in international development. So it's always nice to find out a little bit more about who's with us and share some of those experiences together. So without further ado, I'll go ahead and get started with some small presentations from We Care Solar, Last Mile Health and Living Goods. And then we'll be talking through some various questions around scale. So how do you go from a small idea to something larger? I think for We Care Solar, our journey really started with one woman who was on a real mission and was in Nigeria doing key research on public health and understanding maternal mortality in rural health centers in Nigeria. And out of that, she realized that practitioners were operating in darkness. And it was the kind of darkness that we don't experience that often in the US. It's pitch black darkness. And the idea that you can operate in darkness, perform sutures, perform a cesarean or a complex birth was, it was basically unfathomable that in absolute darkness, they were trying to save women's lives and save babies' lives, and yet they were operating in this absolute darkness. So when Laura brought this problem back to her husband, Hal, in Berkeley, California, they started to think about solutions that were, that were going to actually last, that were going to work for those health centers and be as resource intensive, as resource unintensive, sorry, as possible. And the reality is that clean energy and solar was a big part of that solution, using the power of the sun to really provide a key resource for energy access seemed like a very logical solution for them. But that was 10 years ago. And solar hadn't advanced in anywhere close to the way it is today. And so they used various different things that they were learning in the field through user-centered design research to really develop something that they felt was going to work, was going to be able to actually get to a rural health clinic in Africa that they were going to be able to bring, and to really make that kind of clinic level impact. But again, it was really at the clinic level and thinking health center by health center. And I think they had a real hope that this was going to make a difference in one health center. And what they found after they delivered that to that health center in Nigeria, and then other practitioners were talking and learning about the small solar suitcase that had been installed in this clinic, we began to get requests from around the world for the solar suitcase. And so that's how We Care Solar began. It was from a small idea, from a small innovation that was intended to solve a small problem, and yet it began this process of realizing that this problem was so much larger than anything we could have imagined. And therefore it put Laura and Hal and our team at the time on a path to figure out how could we actually solve this larger problem of energy access in healthcare and maternal mortality and looking at maternal child health. So it's, when we think about our beginnings and we think about the backyard innovation that happened there, as well as the user-centered design that happened out in the field, it all started with a small idea. But what we realized was that the scale of the problem was so large, there was a lot that we could still do to make amazing progress in this area and shining a light on this problem. So now here's just a snapshot of where we are today. We've been extremely fortunate over the last 10 years to have several moments along our path that has now brought us to having installed 5,200 solar suitcases in health facilities across the globe. And that's led to 6.4 million mothers and babies served across the globe. And we're very proud, obviously, of how many solar suitcases have been delivered, but more importantly, that they are used and maintained over time, and that we have health workers trained who know how to use them, how to maintain them, and ensure that there's sustainability over time. In addition, we have very strong government partnerships across particularly our Light Every Birth countries, where we've created national partnerships now with governments that have allowed us to saturate entire countries with solar suitcases and with lighting up healthcare. And this has been an amazing achievement, but there's been a lot of steps along the way between where we started and where we are now. So we're going to talk a bit more about that. This is just a for every one of our Light Every Birth initiative. The Light Every Birth initiative goes country by country to ensure that every public health facility has clean energy for safe childbirth. And this, in 2017, this essentially became our North Star. We determined that this was what we felt was the best pathway to scale, and that national country programs were going to be our best approach to achieving our goals towards solving the problem of energy access and healthcare. So this gives you an overall idea of where we are and where we're going. And all 4 countries that are listed here have very, very active programs at the moment, and Light Every Birth is fully underway. So I've just highlighted a few pivotal moments or things that we felt like were very successful to our journey. One thing in the beginning was really the focus on user-centered design. I've already highlighted that, but that's been a continuous focus for the organization. And I think that it's really led to a very high quality technology that has now lasted the test of time. We know that it's very rugged, it's very easy to maintain, and that has often been highlighted as something that distinguishes our system from other systems that have been rolled out in the field, but in some cases, unfortunately, have failed in many of the countries where we work. Another key element, and Christina will talk about this more later, is really looking at both formal evidence-based research, but also informal best practices for implementation. And this has been a really important part of how we've adapted our approach and how we've changed and pivoted along the way. And it's informed our decisions, and it's made it possible for us to change course at various points in time and really feel like we are learning from what we're doing, and that we're not making any assumptions based on other models or other people's experience. It's really about what we have found to be successful. When we defined Light Every Birth as a model that we could deliver at scale, at that point we were very sure that it was going to be a very high quality model that included not just the technology, which obviously we highlight more, but the programmatic approach has been absolutely critical to the success of the technology. So when we talk about the training, when we have the installation model, the government partnerships, our health partnerships, without those various elements, the program and the solar suitcase wouldn't be as successful. It wouldn't be as successful. It's the other elements in the ecosystem that really leads to that success for making sure that the solar suitcase is installed and used over the long term in the life of technology. I remarked here that it was proving to ourselves and others that the model could be delivered across an entire country. When we had the success of delivering it throughout all of the counties in Liberia, it really proved not just to others, but also to ourselves that it was possible and that it could be done. And I think it allowed the headspace for us to think on such a large scale that we were able to embrace national programs and a larger strategy for implementing Light Every Birth. And I talk here a little bit about building the organizational structure that could support growth, but in a measured and scalable way. So our approach to that was building blocks of really making sure that we had an expandable model that could grow, and then we could fulfill it with, as we were able to gain more funds, we were able to expand, but it also would give us the ability to contract if we needed to, which of course because fundraising in this environment can go up and down, it was really important for us to feel safe in that. And we were able to pursue our agenda in a way that we felt like was controlled and measured, but we were able to define this big, ambitious goal. So I just wanted to, I can look also in the chat, but feel free to write down any questions or reflections that you have on that so that we can discuss and share later. But that's just a small little snippet of We Care Solar's journey to where we are today and our general approach to scale. Alicia, are you ready to go next?
Yeah, I'd be happy to, Sam. That is a tough act to follow, but let's see how we do here. So give me one moment. I'm going to go ahead and look to share my screen. Thanks, Lisa. It is fantastic to be here with you all today. And I think that I also have been really humbled to sort of see the growth that We Care Solar and that Laura and her team have undertaken over the years in countries like Liberia. I wanted to start with this slide because it is one that really shows the power of partnership. And I think particularly when we are speaking today about the benefits of scale, sort of grounding that in something that is really real and that is really personal. And you know, with this picture, sort of a bit of what you're seeing is a midwife at a clinic in southeastern Liberia. This is a clinic that's supported by last mile health trained community health workers and by We Care Solar training and infrastructure. And I love this photo because I think it's just the perfect product of a partnership that is showing a public sector health worker who is deeply committed to her role in providing care, a baby who was born under the light that We Care Solar enabled, and a baby's mother who was supported in her pregnancy by a last mile health supported community health worker to make sure that she received the prenatal care that she needed and that she was effectively referred to a health facility. So, you know, I think that this, when we talk about scale, what we're ultimately talking about is helping more health workers to provide better care to more patients. And I think that that's why we're all here today. So if we are sort of just taking a look here and to sort of give a little bit of context, as I think Sam so beautifully did, about We Care Solar's journey. Last Mile Health exists to save lives in the world's most remote communities. We started in Liberia as a small group of health workers who were partnering with a government that was an immediate post-conflict situation, a Liberian civil war that had just undergone nearly 2 decades of destruction to the country had ended. And there was a health system that was left in shatters. We were sort of seeing that in a country that had about 4 million people, there were roughly 52 doctors to serve the entire country. And we were seeing medications expire in warehouses in the capital city while people died in rural areas for lack of the same medications. And I think a lot of our work actually originated based on the need and sort of the recognition that we were sort of seeing these patients suffer for absence of access to care. So Last Mile Health at that moment in time launched an initiative to professionalize community health workers within the country of Liberia in partnership with the government. And I think as many who are on this call are likely quite aware, community health workers, they're not a new concept. You know, you're going to hear my colleague Lisa McCandless speak so beautifully around some of the excellent work that Living Goods has done around professionalization of community health workers. And I think a lot of what we've sort of seen in our work has been, so for so long, community health workers have been treated as amateurs. They've not been adequately attended to or invested in, and thus they've basically been set up for failure. And that means the continued absence of access to care of the communities that they live in and they serve continue to lack access to care. And much of the work that Last Mile Health, in fact, undertook was to take a look at these workers that were sort of treated as volunteers and to figure out how we could improve their performance. To take a look at how community health workers were recruited, trained, supervised, supplied, and paid to provide care to mothers, children, and families that had previously lacked access to care. And increasingly as we went about this work, we knew that this was not just the fate of one patient in one community, but actually the fate of nearly 1.2 million people in the country of Liberia. And then increasingly, we had an understanding that Liberia was also not alone. Over 1 billion people worldwide, including over 400 million in Africa, actually lack access to care simply because they live too far from a health facility. And I think what many on this call have in fact seen is that illness is universal and access to care is not. And that is really what Last Mile Health and Living Goods and We Care Solar have set about to address. So I think what we're going to have a chance to get into today is a little bit about that progress of taking something that is so intimate and so familiar in one setting and recognizing that it actually has merit and value. And from our initial work at Last Mile Health with about 42 health workers in a remote rural set of communities in Liberia, we've now shifted to work across 5 different countries with the aim of supporting those 5 governments to launch and manage over 16,000 community health workers to provide care to just under 10 million people. And it's a journey that we've come along on with folks like Lisa and Sam and Laura, and we're delighted to dig into that with you today. Thank you.
Thank you very much, Alicia. That's excellent. Lisa, I'll just go ahead and pass it to you if you'd like to speak to the Living Goods journey.
Great, thanks so much. Really a treat to be with all of you today. So Alicia, you did such an excellent job speaking about community health workers and the problem we're all here to solve. So I'm not going to get into too much of that. I thought I would just lift up a couple of specific examples from Living Goods. And like Last Mile Health, we support governments to scale and improve the quality of their community health workers. And a couple ways that we have done that and really seen impact. First is relying on technology. So from the beginning, our founder felt really strongly that we should give community health workers the tools they needed to do the job. And what that meant was first giving them dumb phones and then giving them smartphones, which at that time people really questioned, is there enough money for phones? Should we actually give them smartphones? How is that going to be sustained? And we felt like this is needed and was really going to drive impact. So we put a smartphone in the hands of all of the community health workers we support, and it has been game-changing for us. Not only as that diagnostic tool that she uses in the community to make sure that she's going through the correct protocol, but from a performance management standpoint and an impact standpoint, it's allowed us to see how she's doing. Where is she struggling? Is there perhaps more cases of malaria than you might expect in a certain area, and could something be going on there? Or is there a increased issue of malaria there? So it's really been pivotal to our work and our scaling journey to be able to have that access to data in real time. And Living Goods, like Last Mile and like We Care Solar, has really invested heavily in evidence and research and data. And we believe it's just critical to knowing how you're doing, knowing what to scale when, what's working and what isn't. And in Living Goods' journey to scale, we did a RCT actually early in our journey to look at the impact our community health workers were having on under 5 mortality. And again, something that we did kind of early, we started it from the very beginning, and 3 years later got the results showing that they were in fact saving lives, and community health workers were reducing under 5 mortality by about 25% in the communities where they worked. And that was a really critical moment where our founder, and I actually joined Living Goods right around that time, felt like, okay, we have something here and this is worth scaling. And so that was really kind of go time for us in a number of ways. A couple other points just relevant to the conversation today. We are currently supporting about 11,000 community health workers, serving more than 8 million people across Uganda and Kenya. Like everyone here, we also work at both the national level to kind of improve policy and practice and make sure that there's an enabling environment for community health workers to reach their potential. And our work has become more important than ever, I think, in light of COVID. And I was just looking at our Q3 data, and in the last quarter alone, the community health workers we support assessed 1 million sick children for malaria, diarrhea, and pneumonia. And as you all know, in the light of COVID, it's really critical that people are still accessing basic essential care. And we were really worried in the beginning of the pandemic that there was a high risk that many more people were going to die of these preventable treatable diseases than they might have COVID. So we're really, really proud of that. But that said, I think we also, in our journey, have realized we're still a drop in the bucket. So while we're serving, 10,000 community health workers in 8 million people, that's about 10% of the population of Uganda and Kenya. And then as Alicia, said, and Sam as well, that's still a drop in the bucket when you really think about the overall problem that we're trying to solve. So while we're proud of our growth and, it's presented a lot of opportunity and challenges for us as well, we also are still learning and we're still on this journey. And it's just a treat to be with you all and be on this journey with you. I think we're all trying to always figure out how we can scale our impact and best serve our partners and the communities where we work. So that's it for me. Thanks, Sam.
Thank you so much, Lisa and Alicia. It's just exciting to hear about the journeys. And I know that when we were speaking earlier, just the commonalities and learning from each other is just in and of itself so valuable. And I think that's what we wanted to accomplish today with this forum, was also to share that with others. So what we'll go ahead and do is we'll just work through some of the questions that we thought would be most relevant to the audience about scale and about the successful ingredients to scale. So I just wanted to start, perhaps I'll go ahead and start with Christina and talk a little bit about the point at which your organization decided to scale, and maybe speak to that a bit, Christina.
Thank you, Sam, and thank you for a wonderful overview. And I'm just so humbled to hear the lessons learned from Living Goods and Last Mile Health, so thank you. So Sam spoke a bit about kind of the research that we did. We did both kind of formal research, but also a very informal research, which we call best practices. So I would say when we started to think about scaling, it was after we had done a second round of best practices, which is when we really do a full comprehensive evaluation of our programs and then developed a set of guidelines for how to implement. And we started to, from those best practices, understand that we want to focus on larger and fewer programs. And some of the things we learned from that best practice really fed directly into our scaling pathway through the Light Every Birth initiative. So one example I can speak to is that we learned through our best practices that we want to saturate regions before just dispersing across a wide variety of districts. So really understanding that it's great to make sure that a full district gets coverage entirely before we move on to another district. Another thing that we learned that really led into our scaling pathway was redefining roles of our partners. So in the past, we used to work with a lot of health NGOs who did a lot of implementation for us, and they often had to cost share a lot of those costs. So we would do very comprehensive training, and then often health representatives, not even necessarily technical people from the health NGO, would do installations for us. They would make sure that they do all the M&E. And we've learned over time that if you want to scale, one of the things that we're really focusing on is high quality. So making sure that we're defining roles for the best partners possible. So we learned that we really need to pay subcontract solar installers to do a lot of our installations. We also used to rely, for example, on our partners to do customs clearance, which is the bane, I think, of all of our existence. It's really difficult to get things cleared in a country, so we've learned that we need to kind of outsource that to a professional company. Another thing that we learned through best practices that fed into our scaling pathway was the real benefit and need to directly partner with government. We always were working with government, but often it was indirectly through our health NGOs that were based in the country. And we've really learned the value and the importance of making sure you have solid partnerships directly with government when thinking about a national scale. And we learned, broadly speaking, from Light Every Birth, that larger and fewer programs are more efficient. So we have learned lessons from our best practices. And then we had kind of years of gathering evidence that our proof of concept was working. We were starting to see the real impact of our product. There was a great demand and need for our product, and we had kind of gathered years and years of experience. It was about 2017, 2018. I recall very much that we were asked by a donor, what would you do with $30 million? Or what would you need to solve the problem? And we estimate that there's about 300,000 facilities across the world that lack reliable light and electricity. So when we started to think about what would we need to actually solve that problem, it really got us into a completely different headspace of not just thinking the next 1, 2, 5 years, but really, what do we need to do to solve that problem? And so really thinking big and outside of just kind of our immediate first few years. And then to Sam's point earlier, I think we started in Liberia, which is a country that was tangible. It was a goal that we were able to accomplish, and then started to expand to other countries. And I think it was really when we started to get also generous multi-year flexible funding that we were able to expand to other countries. So it was a long journey to kind of get to where we were, but those were some of the points that allowed us to think about starting to scale.
Thank you very much, Christina. It's such a interesting pathway in terms of looking at different elements that made us more cost effective. Like, I think a lot of those decisions were about how do we actually reach more people with less resources and limited resources? How do we best use our resources? And that was such a critical, that's always been a core value to us. And so a lot of the decisions along the way also informed having more cost-effective programs and really being able to reach more clinics and more people with less. And that was another element there. So a lot of that information fed along the way. Lisa, would you like to address this question as well?
Sure, I'm happy to. And I think there's actually some interesting history of living goods here. But I had mentioned that we did an RCT. And so from the very beginning, Chuck, our founder, wanted to do an RCT to know with as much certainty as you can that what we were doing was working. And we did that, started in 2011. We got the results in 2014. As I said, that showed that our model was working. And interestingly, at the same time, we were experimenting with a different model in Kenya. It was a model where we were trying to prioritize financial sustainability. And because of that, we were not doing as much of the kind of more technical, highly regulated treatment and care work. It was really more of a community health worker selling some more basic, health products. And it was really interesting because when we got the RCT results in Uganda that showed this really clear impact on under 5 mortality, at the same time, we were not surprisingly, but we were not seeing the same health impact in Kenya, but we also weren't seeing the financial impact that we wanted to see. We weren't on as clear or as quick of a path to financial sustainability as we would have wanted to really kind of invest further in that model. And so at that point, we decided to fully embrace the Uganda model as our core model. And then we basically almost restarted in Kenya with that model. So I think it was a good example of how the evidence and the research and just having the data and really knowing like what you are achieving can be really important in terms of thinking about what you are going to scale up. And one thing I would just add, and I just saw a chat, RCT, it's a randomized control trial. It's kind of the gold standard in research that you can do where you have a treatment area and a control. And so you can actually see what the impact of your intervention is because you're essentially controlling for other variables. That's a great question. So that was just really critical to our journey. And I think even since then, we continue to come back to this question of, you know, we're looking at the total addressable market of this problem and how can we Living Goods in this larger ecosystem with partners like everyone here have the biggest impact. And so while we continue to scale our core Uganda model, we're also experimenting with doing other things differently. So for example, working with governments and other partners to have them adapt kind of core principles and practices from our model that can also help them support, you know, more community health workers to get higher quality outcomes. So it's, I think it just goes to say it's kind of a constant evolution of, you know, when are you ready to scale? And then at various points in our scaling journey, we're still asking that same question of, you know, what are we ultimately trying to achieve? Who is best placed to do and pay for that work at scale? And then therefore, what should our Living Goods role be to help achieve that?
Thank you, Lisa. Yeah, it's really fascinating to see, you know, what the commonalities and the journeys, but and just we're going to talk a bit more about organic growth, but some of the things that were literal and intentional decisions, and then otherwise some things that we just learned along the way and figured out, you know, and made a determination to pivot at that point in time. So, so go ahead. Let's see, Alicia, I wanted to talk to you a little bit about, we were going to talk a bit about pivotal moments or action forcing events. This overlaps a bit with the last question, but I just wanted to understand more from your perspective, what some of those pivotal moments were for Last Mile Health in terms of your journey to scale.
Yeah, it's a great question. And I think that one of the things that's sort of striking me as I'm hearing sort of Lisa speak a bit about the incredible thoughtful intentionality with which Living Goods look to scale their work, and that I would point out is that inherently, actually, the utility and the inclusion of community health workforce in a health system is actually a option for increasing access to care in a scalable fashion. And I think that that's actually a bit interesting, because I think that when we sort of looked at recommendations around health system investments that have relied unilaterally on health facilities, there has been a bit of a reorg, I think, in the way that many that are working within the arena of health system extension have begun to look at ways that you can use different practitioners in different ways to make sure that we're actually achieving access for everyone and for 100% of the population. So Last Mile Health's journey was, I think, far less planful in some ways in the early stages than what Lisa just laid out. And I think what we were in fact seeing is that in areas where we were working, there were improvements in terms of health delivery metrics. You know, we were seeing communities and regions in which vaccination rates for children had been roughly 11%, jumping up to 97% of children vaccinated. And I think that we knew that we had something that was generalizable and useful in that moment in time. But I think I would also say that one of the things that was a huge driver in terms of our journey was the Ebola epidemic. And I don't know how many on this call actually recall back in 2014, 2015, a 4-year-old child in the rainforest of Guinea came down with fever, vomiting, diarrhea. And before anyone in the world was really aware, suddenly that child's caregivers had passed away. That child had passed away. We saw that there was an epidemic that had actually spread across multiple countries in West Africa, and that actually deeply impacted Liberia, I think, as We Care Solar and others are quite aware. And I think that it was really in that moment that there was sort of a recognition, one, that the interconnectivity of folks' health and wellness is very real, especially when you're dealing with infectious epidemics. And I think we're in a moment in time right now with coronavirus where there is ample space to learn those lessons again. But back in this 2014-2015 window, Last Mile Health had been at a place where we knew that we were supporting and delivering something that was effective, and it was improving health outcomes in children and in mothers. We were looking for ways in which we might replicate that, and had been intending to be very intentional and measured about it, and then Ebola hit. And I think a lot of what we saw was that there was an instantaneous need to speed up our business plan and to work within the country of Liberia to make sure that there was adequate community health workforce to undertake the types of case identification, health promotion, contact tracing, referrals for care that was required during the Ebola crisis. And the good news is that that was in many ways effective. Liberia was a country where over 10,000 community health workers really worked very valiantly in concert with health facilities and emergency responders to hunt the virus down and to identify patients who required care and to sort of triage those that did. And to kind of take this scenario that had really been forecast to be quite apocalyptic and to bend the curve so that far less lives were lost than had been forecast at one point. And that was, I think, the sort of moment in time in which some of the work that we had done had been accelerated to a larger scale, sort of forcing us, and I think we had a lot of learning affiliated with it, to make sure that our systems and our work and our evidence was up to snuff.
Thank you, Alicia. I think we had some unexpected moments also during Ebola that forced us to adapt and to change and adjust. And I think we're also seeing that happening now, as I think we can speak to a little bit more during our discussion with COVID-19 and just seeing the adaptations that have had to happen this year in light of such a large scale global pandemic. So thank you. Lisa, I wanted to just throw it to you a little bit to talk about some of the, you had made some comments about like funding moments or the ability for funding to facilitate your growth and scale. I just didn't know if you wanted to speak to that just briefly on some of the elements there.
Sure, yeah, I think it's a really important point. And when we first kind of launched our scaling in 2015 after the RCT results, I can't remember the exact numbers, but I want to say our budget went from about 3 million to 9 million. And what was really remarkable about that is the majority of that funding came from current partners. And so we were really fortunate and quite privileged that a number of our funders who had been with us for the early days, like been with us through the proof of concept, when we got those results, they rallied behind us and they said, okay, we agree, there's something here. Let's see if you can achieve the same impact at scale. And that was a question. We didn't know. We didn't know if we could just do this in a smaller number of communities, but could we deliver the same impact, serving many, many more people? And so we were incredibly fortunate to have that support and to have the kind of trust and partnership in those funders to help us make that leap, I think was really, really critical. And then success begets success, right? So then we started getting attention from other folks that could provide even larger amounts of funding, and getting in some folks who really became like an imprimatur for us, getting funding from USAID, DIV, from the SCOLA Award. But I would say it's not only kind of the funding itself, but the partnership those partners have provided us, the trust, the flexibility, the support has been absolutely critical. And I think like a number of us on this call we haven't been an organization that's had a bunch of restricted funding that's really limited us. And I think because of the way in which our partners support us, that's why we were able to be successful, hands down. It wouldn't have happened otherwise. And I think more recently, in the last couple of years, Living Goods and Last Mile Health entered into a partnership with the TED Audacious Project. And that was also kind of another one of these moments where we were able to get multi-year commitments, large multi-year commitments from a number of funders that allowed us to achieve much more quickly. And I think we've really seen in COVID too, how incredibly impactful that was, because we were both, and specifically Living Goods, in a position to respond immediately and save lives immediately. And had we not had that kind of additional infusion of support and capital to allow us to scale kind of this next level, we would not have been in the same position when COVID hit.
Christina, would you like to speak a little bit to also our funding experience with, it's very, very similar, our shared experience. Christina, did you want to add in there?
Sure, I think it's similar. We've had a lot of donors who've kind of stuck with us from the beginning and have been instrumental throughout, and then also new donors that are joining us on this journey. But I think it was really at a point in time when we had really flexible spending, so restricted to the concept of Light Every Birth, but not a specific country or program, that allowed us to really expand and grow. And it was also that multi-year funding that gave us kind of the investment that we know we could really think big and move beyond just 1 or 2 years. So same for us. I think that donors have been such an incredible part of our journey, and the support and the growth, and many donors have pushed us to think larger and bigger. And it's been just, that's really what has allowed us to be where we are today.
Great. I'm going to pivot just a little bit and talk a bit more about the challenges of scale. I think everybody recognizes that there's just various moments along the journey to scale, and I know from our perspective, we wanted to be constantly learning and adapting and changing, and that means that we needed to allow ourselves to acknowledge when something wasn't working and when something was, you know, kind of the big F word of failing, and pivot and change. So I just wanted to talk through that a little bit with you guys about what you felt like the greatest challenges were to that you experienced along your journey, or just sharing a couple examples. Alicia, do you mind starting first?
Yeah, I would be happy to. I would point to 2 things as key challenges around scale. I think one was specific to the path that Last Mile Health had envisioned from the get-go around scale, which involved very deep partnership with public sector. And I think when I think back to sort of 8 or 9 years ago, when we initially were having conversations with folks around engagement with government and acknowledging that government and public sector was going to be a mechanism through which we could more effectively and durably reach more people, especially when we're working in remote rural areas where the market segment is not typically one that's particularly desirable to sort of more private sector for-profit actors. There was a lot of convincing that needed to be done, that paths towards scale that involved government partners were legitimate and worth pursuing. And I think it's been amazing and really refreshing and so important to sort of see that. I think that mindset has changed quite a bit over the past decade. And I feel really proud, I think, of the many different institutions that we've partnered with that were quite skeptical of public sector engagement at the onset, that have actually sort of come along and seeing that this is actually a valid mechanism to ensuring health access and health equity. I think that the second thing that I would actually flag is just much more operational. I think that, you know, for those of us that are sort of in the trenches of really focusing on patient care and building clinical or, you know, public health systems, the focus and the emphasis on program enhancement and program growth, which is so often ambitious and audacious, without, I think, Lisa, you at times have been really thoughtful of saying, like, you need to also pay attention to the boring stuff. And, I think that at Last Mile Health, we were experiencing at times such tremendous growth. I think that we increased sort of the services that we were offering by almost 20-fold within a 16-month period of time at one point. And I think we really struggled to ensure that sort of some of our back office operational systems were able to keep pace. And I think that for organizations and for those that are on this call that are really encouraging and looking for social innovators to grow at a fast pace, making sure that you're not handicapping and that you're bearing in mind the fact that HR, accounting, compliance systems also need to keep up. I think that that's often under acknowledged, but ultimately is fundamental to ensuring that that programming is able to occur. Thanks.
Yeah, absolutely. Lisa, would you like to comment on a couple of your key challenges from your perspective?
Sure. There's been so many. We could have a whole discussion on that. Yeah, two things I'll just add. I think the first being that in our case, moving from being, the primary doer, the implementer, the one that has kind of the control over the full intervention, to moving into being more of an influencing organization, a support, has risen a whole bunch of challenges. I think the way in which we're scaling now, which is not just through our direct operations, it requires different skill sets, different mindset, different capabilities. And you really have to build your capacity in those areas. So I think we've been really humbled in just realizing the difference between doing and supporting, and have learned a lot along the way around how we can become better influencers and not just doers. The other thing I would just say is we definitely had to learn not to be too focused on our model. And we really had to think more broadly and realize it wasn't so much about our model or our exact way of doing things, which in some cases didn't translate to others, and really thinking about the principles and what was driving the impact and how we could translate and share those. So there was also a lot of kind of humility in that, and us needing to be much more flexible around thinking about, what was our special sauce and how did we best share that with others.
Absolutely. Thank you, Lisa. I'd like to go ahead and talk a little bit, just briefly, about kind of our advice to others as they're considering a larger scaling or growth plan. If we were able to go back in time and pretty much give advice to ourselves more than anything, what would be your key advice that you would share with others and that you feel like is the most valuable to share? Christina, could we start with you?
Sure. I think when you're thinking about scale and advice, I think the first thing to do is really know your impact and know your value. So think about, what is the motivation for why you want to scale? Is it aligned with your organizational goals? How is it helping you reach your kind of North Star? So really be clear on that before you begin that pathway. I would also say for one thing that we've learned is we really piloted for a long time. We Care Solar was founded in 2010, and we really didn't start to think about scaling until 2017. So it took us that time to really make sure that we piloted, we gained experience, we gathered evidence so that we were really in a position to be able to scale. I would highlight also building partnerships. We would not be where we are today without our partnerships. They are key to our success. This is government, all of the engineer, technical companies we work with, health NGOs. So we've worked with such a variety of partners to make sure that we are where we are today. We're still a very small, nimble organization, so we really do rely on partnerships to be able to get a greater reach. I think one thing that is unique about We Care Solar is that we really collect and use data to inform not just programs, but the organizational strategy. So making sure that you have a plan that's really based on data, but that to Lisa's point, that you can't be too rigid with that plan. I think one thing that I really strive for is we are committed to learning. We have a set of best practices. We have 21 best practices that we developed for Light Every Birth. But I think COVID-19 is a perfect example that you can't be too stuck in your kind of pathway. You have to challenge your assumptions and be committed to learning and growing and improving. I would also just highlight one thing I think that's successful for us is that when we think about Light Every Birth, it's both an implementation. So we are demonstrating that it is possible to light up an entire country and make sure that every woman and newborn has access to reliable light and electricity. And we're demonstrating that through the Light Every Birth. But, you know, there's 300,000 facilities around the world that don't have access to reliable light. You know, we are, again, a small organization. One way we can get greater reach is through advocacy. So we made it a very intentional point that Light Every Birth was both implementation, but advocacy. And by highlighting this issue, showing research, working with global partners around the world, we can work together to make sure that whether our equipment or another equipment, that all facilities have access to reliable light. So both implementation and advocacy, I think, has been key for our success. I would say those are the hot ones I'd like to highlight. There are a lot, though.
Thank you, Christina. Alicia, I'd like to go to you. I know that Alicia actually has to leave us in a few minutes, so I wanted to get her advice and then perhaps also address one of the questions that had come up from the audience before we pivot to some Q&A and discussion in a few minutes.
Yeah, absolutely. So Sam, you wanted me to sort of speak just briefly to things to bear in mind related to scaling.
Yeah, advice to others.
Yeah, I mean, I think so much of what Christina just shared is very resonant. I would say that perhaps on maybe the softer side of things, one of the things that we really recognized and acknowledged is that we needed to also pay attention to organizational culture. And I think that as our work grew and the types of programming that we were deploying diversified, the recognition that there needed to be a shared understanding that our origin was because there was that patient out there that lacked access to care. And whether we were undertaking work to train health workers, to reform health system policy, to work on health financing and to ensure that that was being deployed more effectively, or to train health systems leaders, all of that was ultimately in service of that patient out there who deserves care. And I think that that helped us to ensure that there was a unifying framework. You know, I think when we're fortunate enough to work with everybody from motorcycle mechanics to, you know, ministry attaches to health systems economists, finding that thread that pulls us all together has been extraordinarily important. And then I would also say, you know, one of the things that has come up, I think, within our organization and in almost every peer organization that I've spoken to as they wrestle with different moments of enhanced scale is the striking the right balance. And I think the appropriate institutional tension that will inevitably emerge around those that feel that you still have not perfected things to the level that you need, and those that feel that you need to be growing and doing more now, today. And figuring out what that middle ground is, I think, is important. And sometimes we'll stumble and sometimes we'll go too far in one direction or another. But I think it's actually quite normal and pretty common for organizations to grapple with it as part of their journey.
Thank you, Alicia. And if you have a couple moments, maybe you could address one of the questions from our audience.
Sure.
This is coming in from Anne-Marie Sevcik. In terms of COVID-19, where do you see possibilities to leverage this ongoing crisis? And what are the risks and concerns that you have with it in curtailing your aims at scaling and sustaining? Great question, Anne-Marie.
Yeah,
I'll give it to Alicia first.
Yeah, such a great question. And, you know, I think Anne-Marie is a colleague that I know many of us on this call have worked with over time. And I think her technical aptitude around this, I would actually be interested to hear what she's observing. I think from our vantage point, one of the things that continues to ring true, and this was true in Ebola and it is true with the coronavirus, that the best health systems and the best emergency response is a well-developed primary care system that you can surge and you can pivot during times of crisis. And the work that I think has been underway with the Sustainable Development Goals or with areas of commitment in which we're looking to achieve universal health access, I think that there is increased recognition that the fate of that patient out there actually comes back to impact, I think, not just our well-being as a society, but the well-being of my family. And the more that we can actually start to lean towards the recognition that well-established primary health systems prevent against pandemics around infectious disease, are also the key to making sure that basic everyday epidemics around children dying from malaria or preventable disease unnecessarily, women being deprived access to the prenatal services that they deserve. It's those health systems that are actually going to address those issues on a day-to-day basis as well.
Alicia, I don't want to hold you up too much, so we might have to say goodbye to her right at the moment. But we just thank you so much for sharing the last mile health scaling journey with us and joining us today in this discussion. I assume that if there's other follow-up questions directly aimed at you, I'll pass them along and connect you to others as well. So we just appreciate you taking the time in light of all of this and sharing so much of your valuable experience with us. So thank you very much.
It's an honor. It's delightful to be with you, and thank you all. I think that we've only been able to accomplish the things because of the partners that are on this call. So be well, everyone.
Okay, thanks a lot, Alicia. So Lisa, I just wanted to see from your perspective whether or not you actually had anything to add to Anne-Marie's question, just in light of COVID-19, and we can talk about it a bit from the We Care Solar side. And just to the audience, please feel free to, we've gotten a few questions here and there, but feel free to add any additional ones. We're happy to stay on for a few minutes for further discussion. I do feel like an hour is just scratching the surface on this topic, and but obviously we really want to be able to hear from you and directly address some of your questions. Lisa, would you like to talk a little bit about COVID-19 and your pivots?
Sure. Yeah, goodness, what a year it's been. To put things into context, we had, a great plan for this year, a lot of continued growth, going from about 10,000 community health workers to 15,000, and a number of work with other countries and supporting them to work on thinking through how to digitalize their community health worker system. And we had to put pause on a lot of that come March and really just double down on how do we best serve the communities where we are right now? How do we protect community health workers and make sure that they can deliver care in a safe way? And how do we support our partners, our government partners, to respond in this moment? And I think there's been, while the plan that we originally envisioned has not happened, there's been just a number of incredible opportunities. And I think some things that have emerged on our end is really seeing the demand for digitalization, and seeing increased interest from partners, from governments, from our community health workers, who early on, when they didn't have PPE, were able to still continue providing care because they had the phone. And so we've really seen that demand, and it's really made us think about, like, how can we continue to move more care into the hands of the patient, and really kind of shift that to more self-care. How can we work with governments to digitalize their systems? And a recent example in Kenya is the government is now looking at developing a whole digital platform for their entire primary healthcare system, which we and a number of other partners are supporting them with. So I think we early on tried to kind of live the motto of don't waste the crisis, and make sure that we first and foremost protected our community health workers and the communities where they work, but also looked for these kind of catalytic moments and pivot points where we could ultimately use this time to reach more people going forward.
Great, thank you so much. I'd like to move on to some of the additional questions now that have come up. How do you coordinate with other organizations working towards the same goal, such as Luala in Kenya and others? Lisa, perhaps you could talk about this a little bit in terms of your partnerships in Kenya.
Sure, yeah, it's a good question. And I think we're in the global health space, and all of us here, we're really fortunate. I think it's a really collaborative space. And at times folks say, well, shouldn't you all be competitive? And we really don't see it that way. There is enough folks out there that need care. We need a number of organizations and approaches and people to be in different geographies and working at different altitudes. So on the community health side, actually, there's a really strong coalition called the Community Health Impact Coalition. And a number of organizations have come together in a more formal capacity to work alongside each other. And that is everything from most recently in Kenya, coordinating with Lawala and others and the government on PPE for community health workers and supporting the government to get PPE out. And in that case, it was pretty practical. We took different geographies where we each had kind of a deeper presence and then became the primary partner in that area to support getting PPE to those places. Or most recently, that coalition is developing guidelines around how to involve community health workers in the COVID vaccine delivery. And so we're working on developing some guidelines that will hopefully inform what UNICEF and others are doing. So there's a very kind of practical, tactical, operational coordination that happens. And then I think we all do really work closely together to think about that higher altitude, the policy and practice, and how can we leverage our collective and individual learnings and evidence to shape the policy and practice at the kind of national or global level. So yeah, I feel incredibly fortunate, but it is a very, very collaborative space and we need each other. So we're very, very lucky for that.
Yeah, I think it's one of those things where in the beginning there's a long time ago, I guess I've been doing this for 20 years now, and I feel like it was much more competitive. And I think what's nice now is that, especially amongst the what are considered the smaller, medium-sized organizations, there's a lot of collaboration that happens across and coalitions that are built, like the Community Health Worker Coalition, and those become very valuable. And just the informal settings as well. We interact with each other a lot and are often asking for advice on different things across because it's just such a valuable community. And it only makes, the work we do stronger and our ability to respond stronger. And that's also been very reflective in our work. Caroline, I think the second part of your question I'll talk to a little bit, which was how do you practically influence the system globally? And that kind of connects a little bit to what Lisa was talking about at the policy level. And I know that for us as We Care Solar, what we call advocacy, but really ultimately it's also influencing the policy agenda, has been extremely important. We've been fortunate that Laura was invited to a lot of spaces to speak about the intersection of energy access and healthcare. And she was able to get on the global stage in numerous different forums to really talk about this problem and shine a light on the problem. And it's allowed us the space to kind of be, even though we are a smaller organization, we have a bigger voice. And that voice has been very powerful in influencing at the donor level, influencing at the government level, and getting other organizations rallied around this problem and an awareness that, if you as an organization put in a piece of equipment into a health center and yet they have absolutely no reliable source of power, that's wasted money, that's wasted dollars that just went into that equipment. So recognizing that there has to be this core building block there before you can actually really make a difference in a health center has been critical to us. So I think that it's taken a lot of different steps of engagement to influence that, but I think that it's an extremely important part of trying to solve a problem. And I think also I just wanted to, I think we've been sharing some information too about the petition that we are circulating, and this is our Light of Rebirth advocacy petition that says that every woman has the right to safe childbirth and energy access. And so we'll share the links in it, but that is also something that we are asking individuals, donors, institutions to sign. And over the course of the next year, we'll be using that as another tool for our advocacy to push to get greater support for solving the problem of energy access in healthcare. So I'll plug that one there on the side. I'm looking into see additional questions that have come across. There's some individual questions which I think we'll address individually, but I just wanted to open it up, and people also can feel free to take their put their cameras on or ask a question in person. But I think for the most part, we've addressed most of our burning questions at this point. And so I wanted to give, did anyone else, it's nice to see some faces popping up on the camera.
We could invite Robin Podmore, who's been working with IEEE on trying to scale up smart energy solutions. It sounds like he has a question. Robin, did you want to mention what you're doing and talk about that for a moment?
Robin, could you unmute really quickly? Let's see.
Thank you.
There we go.
Yeah, wonderful to see you, Laura and Hal, from 10 years ago when we both got started. Congratulations. I'm with IEEE Smart Village, and we are involved in providing electricity, and we're really starting to go to scale. And now we're working with Dr. Jack Higgins on the Global Telehealth Network. But I want to propose the idea that we can now provide you with electric ambulances which can carry the panels, and those ambulances can just go wherever the sun shines, okay? So there is no need for diesel. So we're really looking, just tremendous to meet you all. We're also working actively in Kenya, but we're in about 15 different countries throughout Africa. We're very proud. Every one of the solar systems we installed is still operating today. Every entrepreneur we started is still in operations today. And we really see a wonderful opportunity to not only provide more extensive electricity at a lower cost and have it simple enough that the nurse can maintain it, but also get them involved in the internet wherever they're at. And then also not only get them reliable electricity, get them good internet access, and then let you have mobile clinics that can literally carry the panels and just set them up wherever you want. You don't need any diesel. You can just take those, but we all obviously need your input about what those clinics would look like. And then again, we're all about, like you said, training our frontline workers. In our case, we're training the Maasai woman and youth to not only do beadwork and make bricks, but we're going to train the Maasai woman to ride little four-wheel vehicles. It's not culturally acceptable for them to ride the Buddha motorcycles, so we want to empower the women to have their own little electric UTVs to move around. So it's so exciting to see you all, and it's so exciting to see how I remember with Hal and I tell this story. I never had tears in my eyes at an IEEE professional meeting until I met Hal and Laura, and they were showing what you all do. So congratulations, and let's just keep working together just to figure out how to do all the preventative health that you're all talking about. And so I look forward to following up with each of you to share all the plans. And one of my favorite sites is the Masai Mara. We're going through an amazing transformation, and really learning. Yes, like you all said, we can. All of our partners are available 24/7 now on WhatsApp. We can really stay in touch and share those best practices. So I'm a newbie to health, but I'm learning as much as I can. And again, we look forward, and congratulations to each of you for surviving with your organizations. And now it's all about taking the fundraising to a whole nother level, okay? And really, I mean, an average university in the US has $1 billion of R&D funding. Okay, we need to get into that and kind of have, and there's no reason why you can't be doing your master's or your PhD right now in the village. Okay, once we get clean, safe water, internet, an electric vehicle, who wouldn't rather be in the, we're literally convincing people you're better off to stay on the farm and stay there, okay, and get all the wonderful experiences. So congratulations on all the hard work, but we've got to really ramp it up by all working together. Thank you so much.
Thank you, Robin. I think that's, it's so many key points that are particularly poignant right now with COVID-19 and all of us trying to address things in different ways, particularly the links to telehealth, like Lisa was talking about, and the increased demand that we're seeing, and understanding that all kinds of things are possible right now in this moment to pivot and address needs and make sure that the needs of those in very far away places in the last mile are being addressed at the same time that we're very wrapped up into also what is going on in our own country and frustrated, but recognizing that health equity is more important than ever right now across the globe. And it just continues to be such an important area for all of us to be working towards, and to continue to know that we're making an impact and able to work towards progress as an organization. So thanks, Robin, for your comments. Lisa, I just wanted to see if you had any parting words or last words, and open it up to you before we go ahead and close.
I just wanted to say what a delight to spend this time with you all. So thanks for having me. It's a treat to be with you, and we've learned a lot from We Care Solar, and continue to learn a lot. And back to the question on partnership, I was also thinking about, Alicia said this so beautifully in the beginning, but an organization like Living Goods, our impact really does, we reach a point where we can't do anymore. We don't actually do anything at the facility. So we help get moms to the facility to have a safe birth, but we don't actually, us Living Goods, have a way to actually, affect what happens when she gets there. Is there light? Is the right equipment there? And so it's so critical that we are all doing this work together, and just so grateful for your all work and this community. And yeah, I just wish everyone well, and thanks for having me today.
Thanks, Lisa. Christina, any final words that you'd like to share with the group?
Sure, thank you. I'm learning a lot, and it's just been such a delight to spend this time with everyone the past hour or so. I would maybe end on just the comment that I think we are talking a lot about scale and the motivation and how we've grown, but I would also just comment that scale I don't think is always right for every organization. I think that you really have to think about your motivation. When we think of scale, it's exponential growth, and that's often the defining factor, but it's so much more than that. It's effective growth, it's efficient growth, it's growth that's growing and learning, it's growth that can be replicated, it's growth that can be consistently proven and in high quality. So I think scale is a really big, ambitious goal, and to really think through that before going down that pathway. But again, I've learned so much, and I really appreciate everyone's attendance, and just I'm delighted that we can share this space and really learn from each other. I echo everything about partnerships. It's just such a delight to work in a space where together we're stronger than separate, especially during this time of COVID-19. So thank you.
No, thank you very much, Christina and Lisa. I think that we achieved our goals in terms of having an enriching conversation that I hope that everyone has been able to engage and to learn a bit from, and have some key takeaways that will help them in their daily work. So really appreciate both of you for joining and for engaging in the conversation. And just to the entire audience, we are just so grateful and thankful to all of our attendees from the 10 by 10 series who have joined us in celebrating our 10 years of implementation and success. And we're just excited about what the next 10 years are going to bring. I think we've talked about our journey and what's possible, and where we may or may not have envisioned ourselves 10 years ago, and where we are right now. And I continue as the leader of the organization and of our team to be extremely proud of the work that we're doing. This year has been a testament to that, of how everyone has pivoted, everyone has risen to the challenge, and it's been a phenomenal year to just watch our work in action. And so it's just exciting to think about the next 10 years and what our organizations are going to be able to do. So I'm very grateful and appreciative of that. So thank you everyone for joining, and we really appreciate it. And please let us know if you have any individual questions and would like to follow up with us individually. So we'll end the session now, and thank you very much, everyone.